Hello, everyone. It's another day with your fertility specialist. On behalf of Alps Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. It's always a pleasure to have you guys with us every Wednesday and Friday. I'm your host for this session today. I'm Ruth Ogogo, and I'm very happy to be with you all this afternoon. Today, we'll be talking about fertility testimonial. Some people that have had their own share of life experience with fertility, conception difficulty, and yes, what have you. For someone that might be struggling with conception at the moment, this is to let you know that you're not alone in this journey. That's why we're bringing this to you to strengthen your hope, to reassure you that yes, you might not be having it all put together now, but you could still achieve your dreams, even if not now, but sooner or later, you definitely achieve those dreams. And so, to deal with this testimonial today, we have Dr. Deborah Olubi. Dr. Deborah, it's good to have you.
Thank you very much, Ruth. It's always a pleasure to be here. Good afternoon, viewers.
So, viewers, as we get started, please share this link with someone, call up someone, as many people that you know are having difficulty with conception, not even just people, just anyone you know you could call up. Someone that knows somebody that knows somebody that knows somebody that might just be dealing with infertility. Please call them up right now because this is just for them. And it soon be good that they miss out on such an important information that will be released on this platform today. Feel free to drop your thoughts, your comments, your question in the comment section, and we'll definitely attend to them. So I hope that you're very attentive as we deal with this testimonial right now. Okay, so it reads, um, well, today we have a game changer. Yeah, most of the time it's the women that actually talk about their experience,
Yes, yeah.
but we have a husband talking about their
Okay,
fertility
that's a
journey
good one.
today. Yeah. So please, husbands, if you have gone through this path, please
Yeah.
feel free to reach out to us so we could also share this testimonial to encourage someone, wives that have gone through struggling with conception and eventually you did achieve conception and live birth, please feel free to reach out to us with your testimonial so that we could read it out like this, just where we are reading out the ones that people have read to encourage someone out there. I know they said the spirit of testimony is the spirit of prophecy. There's this talk about it when you go to the church part. So you never can tell who we are prophesying to when you are reading this
Yeah.
testimonial. Well, that's just on a lighter note, but this is just to say you're encouraged to actually share your testimony. You never know who it is that you may
Will
actually be
benefit,
reaching out to
yeah,
or helping out.
and
Someone,
inspire and give encouragement to.
yeah.
Yeah, we're sharing these stories to encourage people.
Mm.
You know.
Okay, so he said, trying to start a family was nothing like what we imagined. We began with excitement, full of hope. Of course, anyone that gets married, there's this euphoria, excitement, and
Yeah.
all that they would share. And then he said, but month after month, year after year, the same negative results kept
Mm.
crushing them. So he said, when the doctor recommended IUI, apparently, yes, in their own case now, they started seeking help. And the first point of from what he said, that the doctor had recommended IUI, he said they believed it was their breakthrough. Maybe, okay, since spontaneous conception is not
What's
happening,
happening? Yeah.
maybe they are trying something different. Well, let's even talk a bit. What's IUI? Because I know you've had some people that will just come straight, and is it everybody that can actually just go for an IUI?
IUI. Yeah. So IUI is intrauterine insemination.
Okay.
So what happens in an IUI is that the woman's ovaries is stimulated. We do what we
Okay.
call ovulation induction to
Okay.
cause our ovaries to produce multiple eggs,
Okay.
and then the man's sperm is produced, and then is injected directly into the woman's womb in
Oh,
the
wow.
theater. So we don't allow for a natural meeting of a man and woman, but you
Mm.
assist the process by injecting the sperm directly into the woman's reproductive tract. So that's what IUI. Essentially, for IUI, the tubes must be open.
Oh, okay.
Yes, so there must be no tubal occlusion or
Oh,
tubal disease.
okay. Mm.
Yes, so the fallopian tubes must be open, and then the sperm must be of a certain quality in terms
Mm.
of count, in terms of motility, in terms of the motility for a couple to be able to do an IUI.
Wow, wow.
Yes.
So hope we note that, because sometimes some people just come and say, okay, I don't want to do IVF,
Yes, I want
and
to do IUI.
yes,
It's
and
not. It's not you to
oh
choose.
yeah,
It's your doctor
exactly.
that will evaluate you and suggest that okay, IUI could work for you,
Mm,
because a woman must be producing eggs for you
mm,
to even have an IUI. There must be eggs for the
exactly.
sperm to fertilize. Yes, so the doctor will be the one. Is the one in the best position after thoroughly evaluating you to tell you that okay, madam, we can try an IUI first. Yes.
Wow. So she said, well, three IUIs all failed. That's sad. Really, I can imagine
Mm.
how people
Yeah.
deal with this. And it's not like it's also free. It's something that they pay
Yeah.
for.
Definitely.
It's
Yes.
I know that it's not just as expensive as IVF.
IVF
Yeah,
is not.
that's
No.
why some people just easily jump at it, I guess,
Exactly. I want to
and
have
they
an
will
eye.
suggest it because they are looking at for maybe the easy way out or
And then they
something.
feel it's something assisted, but
Mm.
you must meet the criteria for it to be done for you. Yeah.
Okay, so he said each one felt heavier than the last. He said my wife, that's his wife, held her tears during the day, and at
Mm.
night she cried in his arms. He said he tried to be strong, but it was hurting just as deeply. Well, from this point of view, we can see that in a way this is a very supportive husband.
Yeah,
Sometimes
very, very
maybe you should
supportive.
talk a bit to couples, because
Mm.
sometimes it feels like it's the women that carry this
All the
burden and
burden,
all of that.
exactly.
Maybe you
So
should talk
our
a bit to
men folks,
couple.
our husbands need to be more supportive. In our society, usually fertility issues, a woman is always at the brunt of the blame.
Mm,
But we know that fertility is from both couples, both the man and the woman, that needs to be in good condition for
yeah.
pregnancy to happen. So there are male factor. There's a lot of infertility that is male factor. Male factor accounts for the same number as
Mm,
female factor relating to infertility. And
well,
a lot of times it could even be a joint problem. The man has issues,
mm,
the woman has
has
issues. Yeah,
issues.
so we shouldn't always be looking at the woman being the only issue or the cause of the problem. So you are a unit. Whoever is the cause of the problem, your focus should be on a solution, not
Yes,
laying
blame games.
blame on anybody. Yes, so we need our husbands and the men to be more supportive of their wives.
Mm,
Your family, the society is already looking at the woman. When you now join them to lay the blame at
yeah,
her feet, that doesn't help the process, because she needs to be in a right frame of mind. Her emotions and everything needs to
it's
be in
check
the right place, even for all these assisted fertility
to work.
techniques to work.
Mm.
So we need our husbands to be more supportive, need the men folks to be more supportive.
Let
Yes.
me even talk a bit about in-laws. Sometimes the kind of pressure that even in-laws mount on women,
Exactly.
and
Yeah.
it's possible that it's even their
The
brother
man that is the
that
cause of
has
the
the issue,
problem.
but the
Exactly.
woman will not come up front to
Yeah.
say
Man
it's your
hide.
son or
Exactly.
your brother
Yes.
that actually has the issues. She
Yes.
carries
A
this
lot
burden,
of
and
women
then
will hide that. Yes.
mm,
They-
they
yeah.
won't come out front to say the one that is
Yes.
the issue. The woman keeps hearing, and then the relative keep mounting pressure, and behind the man will be pleading with the wife, just try to
Stand
understand.
with them.
And then
But
he's not attacking his in-laws that okay,
instead
you
of
people should
facing
stop
them,
and face
yes,
them.
this is our
Then you allow
problem.
the
It's not
woman to
just
be
my wife.
collecting
Yes.
undue pressure. And
Pressure,
then
and
I
yes.
think that's something that men should actually work on, because sometimes some men now, at least you've mentioned that now it's almost becoming equal, the cause of
Yes.
infertility for both
Yes.
men and
Male,
women.
male,
So
yes.
you should learn to also face, because sometimes women, the kind of pressure they get from
A
in-laws
lot.
alone,
A lot.
and then to now think that it's not even her
Her
fault,
fault.
then she's now taking so much
And
pressure,
then you
and
see
you are the
some,
man, you are just behind.
yes, and you see so
um
many women bearing with these men for years
mm,
until other issues now set
set
in, like
in. That's
age
true.
affecting her,
Yes,
reproduction and so on. But
yes,
if the man
Kai,
was okay from the beginning, she would have had her children.
that's
But age now
true.
sets in along the way. Yes,
Mm,
see so many of them keeping quiet in those relationships, just bearing the brunt,
and all
bearing the
that.
blame, covering in quote their husband's shame.
Shame,
But the
yes.
husband doesn't even protect them outside, doesn't protect them
It's
against his
sad.
family. It's really sad. It's really
So
sad.
please,
Mm.
in-laws, face your business, please. Don't be don't be intruding into their issues. If you must intrude, it should be to provide solution, and not
Exactly.
to badmouth or mount so much pressure, and then you can even make somebody to go and commit suicide at the
Mm.
end of the day because of so much pressure. Please, all of you should mind your business. Well, yes, this is just a way of saying that sometimes you really do not have to if you feel you cannot control yourself, there are better ways you could go about it, not mounting so much pressure and then being so offensive towards the couple that their whole life seems almost miserable because of the
Yeah.
pressure they are getting from within the family. That's just a little digression, because we could see from this testimony that this man was very supportive. I mean,
Yeah.
for the man to even take the courage to share this
The
testimony,
testimony,
it
yes.
already speaks a lot of volume about him. So I'm sure this is just the list of one of the things that he could have actually been to his wife. So much support through it. So he said, still they kept going, and then apparently they got to the point of IVF. They had a first cycle that
Okay.
failed. They also had a second cycle. Well, the second cycle apparently showed that it succeeded, but by the time they were going to have a scan,
Okay.
they didn't see nothing. Well, are there times that you could have people actually do pregnancy tests after an IVF, it's positive, and then later you are not seeing nothing?
Yeah, pregnancy test can be positive, but what confirms if the pregnancy is viable is when you see the baby and you see the baby's heart beating. So that's
Mm,
why we usually do a scan 2 weeks after a pregnancy test. That's when
okay.
we come. Yes,
Mm,
pregnancy test is this pregnant. The first, you're measuring
oh,
a hormone in the blood, like a
oh,
chemical.
okay.
But
Oh,
when you actually see the baby in the womb, that's the confirmation that
the
this is a viable
pregnancy is
pregnancy.
viable.
So what
Wow.
she must have had must have been a chemical pregnancy.
Oh,
Yes, and we see
sweet one.
that happening sometimes. Yes, we
Hmm.
see that happening sometimes.
Wow, so that means even after you've done pregnancy test, your heart will still be up, sort of, in a way. Yes, one hurdle crossed,
Pros,
but then
exactly. It's a good
there's still
sign.
another
Yes, there's
one.
still
So
another
another
one
hope
for.
of saying, Father, let it progress
Yeah,
and all of that.
exactly. Yes.
So well, so they had this experience. I can imagine what they had to go through. After jubilating that it was positive for the first time
Yes.
after so many years of
Yes, of
waiting, only for
exactly.
them to do a scan and they're like, we're not seeing anything. And I'm sure they'll be like, doctor, check very well.
Well,
Should we come back? Should I drink water? Should I go and pee? I'm just imagining all the
yeah,
drama that
yeah.
will be involved, and then getting to the point of accepting that, okay, this pregnancy didn't progress.
Progress.
And then after that, they had another. Well, this couple, I must say that they are really
You must.
resilient.
That's what I
They
wanted to
are
say. You must
really.
commend their
Oh yes,
resilience. You must,
yeah.
yeah, and not giving up. And that's the kind of attitude we preach, and encourage our clients to have. Everybody's journey, and that's why we share these stories to show you the kind of journeys, the experiences people have to go through. Sometimes
Mm,
everybody doesn't go on the same journey,
mm,
and that's why sometimes when you see clients, maybe in the facility discussing among themselves,
yes.
your journey cannot be entirely the same with
Same,
anybody. Yeah, so
exactly.
the clients, your people going through it should not be your last spot of receiving advice. You should
Mm,
always adhere to the counsel that your practitioner, the help person, your fertility doctor tells you.
tells you.
Yes, because everybody's journey is unique and it's different. So
Mm,
we must really commend them. Imagine the journey so far where you've reached,
exactly.
all what
Yes.
they've gone through, and
And
they
all
were still
that.
ready to
Wow.
forge ahead, not
Head.
giving up. That's
I
really commendable.
I know sometimes people say, the money is not there, IVF is not cheap, but if it's something you set your mind to do, it's
Yeah.
something that you can actually work towards
Yes,
achieving.
definitely.
And once
Yes.
you something you have in mind, you keep working towards it until you're able
Yes.
to. But if you've given up, you won't even see the need to
To
push
work.
or forge ahead,
Exactly.
or
Yes.
even try again and all of that. So well, so now they had a third cycle IVF and still it failed. Wow.
Hmm.
This is a lot,
This is a
actually.
lot
This is
for
a
any
lot.
human being.
This is a
It
lot. So
is.
they said everyone kept mentioning. Apparently, okay, for someone, that's one thing with fertility journey. When you come to the hospital, you meet different people. It's just like Dr. Debbie mentioned that sometimes you see clients discussing. From
Yeah.
there, you start
Comparing
hearing some
themselves
they
with
compare.
the doctor.
Yeah,
Why did you do this for this person?
I
This
know.
person said she's getting this.
Yeah,
Oh, your tough story. What we're
exactly.
treating, they're not the same. You don't have exactly the same issues. Yes.
Mm.
So the treatments can be the same.
So he
Yes.
said a lot of people had been mentioning Alps hospitals. Oh wow, Alps hospitals. So he said at first they had ignored apparently where they were trying. I don't know. They didn't mention the different places they had
Okay.
tried, but they have had three IVF now from this and it didn't succeed. Well, at some point they said they felt tired, drained, and disappointed. But then they said, okay, let them just even try these Alps that they've been hearing people talk about. And he said when they got to Alps, well, it was warm, calm, reassuring. Well, for someone wondering where Alps is, just come around. Maybe you'll see for yourself and be convinced that these are actually very valid points that have been made here. So the IVF team, they said they listened very deeply. They did a lot of assessment. Well, I didn't want to do verbatim reading, but
Okay.
basically, he said a lot of should I say now, detail attention was paid to the very keen attention was paid to every detail they gave, so they could deduce one or two information that could be helped or that could help with the way forward.
Forward,
Because for
yes.
someone
Very
that's had three failed
IVF.
IVF,
You want
three
you'll be wondering
IVF,
what
and
could
all
have
of
been
that,
the cause.
yes.
Yeah.
So at some point, okay, so she said she had a scan, and the doctor had mentioned that what from the scan you could see something like look like the scar from the scan. So they
Okay.
further recommended the procedure hysteroscopy for them,
Okay.
of which they were open to, because she said she had had a fibroid surgery. From what she mentioned, she said
Okay.
she had had a fibroid
In the
surgery.
past. Okay.
So, well, with that information, they could
So that
tell that it's
means
possible.
she had,
Maybe you should tell us a bit before we talk about she. Because now she had to do hysteroscopy and she gave some information.
yeah. So that
So,
scar is in like in the lining of the womb, and yes,
mm,
intrauterine adhesions
okay.
scarring. Yes. So
Oh
that
wow.
when there's adhesions in the lining, you know that the inner part of the womb or uterus, the
Yes.
endometrium, that's where implantation and pregnancy happens.
Okay.
Yes. So when there's scar tissues there, so that place there's supposed to be a space like a cavity.
Mm,
The place now sticks together.
mm.
So it's like that space is close. So that's what
Wow.
adhesions and scar tissue does.
Wow. Wow.
So, and a lot of things could be responsible. She mentioned surgery, some uterine surgeries like cesarean
Mm.
section, like if the myomectomy,
She
fibroid
had.
surgery. She
Yeah.
mentioned yes,
Wow.
especially when the lining is breached, could
Mm.
lead to that scarring happening. Yes, other things could cause it, like infections following a miscarriage. Following even after delivery, if after delivery woman is not properly managed and she develops infections in her reproductive system. So infections following miscarriage, following delivery, even following some uterine surgery, like people that have DNCs, all
Mm.
that could encourage
Wow.
scarring of the lining of the womb. Yes. So like in our case, that myomectomy could be the cause of
Mm.
the scarring. And it's really unfortunate that she has had
So many
several
cycles,
IVFs, and
exactly,
I
and they didn't
assume she
look
must have
into
had
it.
scans done and they
Yes,
couldn't
and they
pick
couldn't
pick
pick
that
it.
scarring.
Wow.
And
Mm.
that's a very, viable reason for why
Failure
IVF
might be
can fail.
happening.
Yes,
Mm.
that's a very major reason why IVF can
It can
fail,
fail.
because when there are scars, the normal uterine, intrauterine tissue, endometrial tissue is compromised. So the
Mm.
lining doesn't build up as it should to support pregnancy. Even if
Mm.
pregnancy should happen, miscarriage is
Could
also very common.
happen.
Yes.
Wow.
So
Wow.
that's, thank God that was discovered. Okay. So
Mm.
she had a hysteroscopy.
Yes, so she said she
Yes.
had a stereoscopy, and they said there were a lot of
You
adhesions.
see? Yeah.
She said since she had a fibroid surgery, but like I've mentioned, they have let us know. So it's possible that she might have had infections too that could have actually resulted to a
Yes.
lot of adhesions. So she said yes, she had a stereoscopy done and all that. Well, let me not go into so much. She talked a lot about how they said findings from the stereoscopy, they
Endoscopy.
saw
Okay.
scar and all that.
Okay.
The additions were much and how they tried to manage it. Like she
To
talked
remove
about
as much of it as
medications
she
too and
was
all that.
given, to
Yes,
encourage healing,
and all of
and
that.
growth of the
Yes,
lining. Yeah.
yes. So afterwards, let's fast forward to when she now eventually prepared for an IVF. So she said, um, treatments commenced. Okay, so she talked about how all the treatment went, or how there was careful monitoring of every process that she had to go through with the IVF. But she talked a lot about how ALPS managed her treatment and how they were so professional about everything that she was doing for the IVF.
Okay.
Like, okay, so she was trying to say that ALPS was just different about the way they managed her with everything they did. Like, she could see that something was just different about all the others that she had
Treatments that
had.
she has had.
So
Yeah.
yeah, a lot of us sometimes we have our experiences with different places, and that's why you don't give up on IVF.
Yeah.
Sometimes too, even in the same place you have done, if they keep doing the same thing over and over again, then you would want to say, okay, maybe you change to somewhere,
Try
because
something different.
if something doesn't work, you might want to try another way, because sometimes IVF could fail, and yes, you might not have the valid explanation as to why
Yeah.
it failed.
Nothing wrong might have been done, and IVF could still fail. Yes.
Fail.
Yes.
So that means so maybe let's talk a bit, because this is something, it's difficult for people to pick up the pieces when
It
they have,
failed.
yes,
Mm.
exactly, because they feel like we've done everything that you wanted us to do. Why did you fail?
Yeah, because
What's
yeah,
happening
that's
and all
very
of
true.
that.
Because you hear clients telling you, doctor, what did I do wrong? I wasn't eating. I did everything you said. I said, madam, we tell them you didn't do anything wrong. IVF can fail. Success rate for IVF, like we keep saying, is not 100%. Even the best of centers in the world, success rate is put about between 30 to 35%. You know, everything looking good, just 30 to 35% of
Yeah.
women might succeed when you have 100 women. But all the things we do in apps, that's what gives us our unique edge. We do a lot of thorough evaluation. She had been having IVF in other centers, and they didn't pick those intrauterine
Yeah.
scars, the adhesions. And then in apps, this was picked, and then she had a hysteroscopy. So those extra things we do is what gives us the kind of success rates we have. So like you said, you don't give up. You don't give up, yes. And if you feel where you are, you're not getting value for your money, please, go where you will get value for your money. No helps is somewhere you get value for your money. So hope is very important in life. Hope to keep moving forward. Imagine if they had given up after the
Yeah.
three IUIs, or giving up after the first IVF or the second or third. Imagine even having to change facilities. Like we said, we must really commend this couple. They refuse to give up.
Yeah.
When you hold tightly to your dream and refuse to give up, I know a breakthrough must come at the end of the day. So that's the message we give our clients. Don't give up. Even people, yeah, people have IVF in our facility and sometimes they fail. We still encourage them, like we say, we do a forensic of the treatment, try to find out,
Why?
what could have led to the failure, and then what can be done to correct it, what can be done going forward. Even when we've done a forensic and we can't really see
What
any
went
reason why
wrong?
this
Yeah.
couple failed, we still encourage them, madam, don't give up. Let's still try again. Because research has shown that success rate for IVF increases with each attempt you have. Yes, the success rate keeps going up because especially when it's done in the same facility, we gain an understanding, a better understanding of the client after they've gone through the treatment. Yes, when you do an evaluation, you have an understanding, but by the time you go through the treatment, you have more understanding of this client, how they respond to this drug, how they respond to that drug, and that can help you when they're trying again, to do things differently that could lead to success. And that's why we encourage our clients not to give up.
So saw a part where they talked about a frozen embryo transfer. So apparently they said that they had embryos from the place where they had done the IVF before that were
Okay,
frozen.
okay.
So yeah, because I saw that she was talking a lot about you monitoring the growth of her
Lining.
lining.
So she
Yes.
didn't have a fresh
Yes,
stimulation with
yes.
us. Yes.
So apparently they requested that from where they had, because I think when they came to ours, they asked if they could, and if not, they'll just forget about the embryo and just do a fresh
Before.
treatment.
Okay.
But Alps had let them know that they could actually transport their frozen
Yeah.
embryo
Yes.
to Alps Hospital where they want
Yes.
to do their treatment. So maybe you talk a bit, because I'm sure some people will also be
Yes,
in
we
this
are. Yes,
category.
that's something we do at Alps Hospital. So if clients that have embryos saved or stored for them somewhere, if they come to us and want to have a treatment, instead of starting afresh, especially when we assess that the gradings of those embryos, they are good grade embryos. Those embryos can be, shipped to us. They can be
Oh,
sent to
wow.
us. Yes,
Wow.
we've had that done with a lot of our clients, both locally in the country, Nigeria, and even from outside the country. The embryos are
Wow.
shipped to us. Yes,
Wow.
and then the
That's a
client
lot.
will be prepared. Yes, the
Wow.
client will be prepared for a frozen embryo transfer. So that is very, very possible. It's something we do all the time.
Wow,
Yes,
technology
yeah,
has really gone far,
it
and
has, it
it's good
has.
that Alps actually embraces this technology in a very, very big way. So they eventually had the frozen embryo transfer. So she said the day of the frozen embryo transfer was peaceful and we didn't overhype it. We left Alps holding hands, trusting God and trusting the process. So she said, so after the wait finally ended, but not in the way we expected, she said, okay, home pregnancy test. She said that morning, her husband quickly took a home pregnancy test, more like okay, his wife, because that's
Your
it's
husband
the
speaking.
speaking. Yes, he said that
Yeah.
morning, my wife quietly took a home pregnancy test. She didn't tell me, she just couldn't wait any longer.
That
So he
pregnancy
said
test date.
she walked into the room. So apparently she didn't even tell him that when he was actually
She wanted to
around.
see it for herself first.
He said her hand was shaking. He said, "Oh, two lines, clear,
Oh
bold,
my.
real." Oh wow. So he said, but after that, all they had been through, At this point, they had had a chemical pregnancy.
Yeah, the
So
excitement
they
to
were
be
not they
not
were
too
afraid to celebrate.
I can
Exactly. So he
imagine.
said
Yes.
we were afraid to celebrate, afraid it might disappear, afraid it would be another false
Yeah.
hope. I
God,
can
I
imagine,
can imagine,
honestly.
putting yourself in these people's shoes.
Yeah.
Uh,
Because you are
God.
seeing something that's
Yeah,
supposed
but
to
you
be
know that
seen,
you
but
can't
you're saying, oh
celebrate
my
yet.
god. So
You
she
can't
said,
celebrate
said
yet.
they're afraid it was another false hope. So she whispered, what if it's wrong? What if it's not
Hmm.
real? We didn't wait another second. So they actually eventually came to the hospital to do a blood test and did a blood test. And yes, it was positive. Now, well, after it was positive, they were very happy, but the 2 weeks wait the two
For
weeks
to do
wait
the
now
first scan.
eventually, yes, the 2 weeks wait
Hmm.
to do a scan. So she said returning for the heartbeat scan felt
She's calling
like
it heartbeat, not scanner. Real
felt
heartbeat
like
scan.
dream stepping into a dream. Hearing that strong steady heartbeat, it was the sound that we had prayed for all our lives. So I can imagine. So yeah, apparently they could see from the scan, or maybe they had a way of making them hear the
Get the heartbeat.
beats. Yes,
Yes.
exactly. So that was something that's, of course, for someone that's had that bad experience of
Yeah.
pregnancy not
This was now
progressing, that
reassuring
was,
at
yes,
least.
this
They
was
were,
reassuring that okay,
yes.
yes, there's hope, there's something
Yes.
going on there, there's a
Exactly.
baby growing up on
Yes.
there and all of
Yes.
that. So they said today, wherever we, whenever we tell our story, we tell it with full hearts. God came through. Alps gave us clarity and direction. Our love held us together, and our miracle found us right on time.
Hmm.
Because truly, delay is not denied. So sometimes God leads you to the right place at the right moment. For us, that place was wow. That's
Man
so
has become a poet. No, but
wow.
this is really a heartwarming story.
Hmm.
It's really a heartwarming. We're really grateful to this couple, the man, for sharing
Hmm.
the story. So,
Yes.
so that people just see that the journey can come in different forms.
Ways.
Hope and not giving up is just what you hold on to. And
Hmm.
then talking about this this scan we do, the first scan, viability scan.
Yeah.
The way people develop at different rates. Babies, fetuses, the embryos could also develop at different
Different
rates.
rates.
So
Hmm.
usually when we do the first scan, and we're not seeing all we should, we don't just conclude that this pregnancy
Okay.
is not viable. Sometimes we give a
Hmm.
little time. Sometimes there are further testing we do, like doing
Hmm.
the quantitative pregnancy test, beta HCG, measuring
Oh,
it,
okay.
yes,
Hmm.
and using that to monitor. So if you have your first scan and the doctor is telling you they're not seeing everything they need to
Hmm.
see, all hope is still not lost. Sometimes something still comes out of it, when you
Hmm.
just give it a little more time.
Wow.
Yeah.
So hope we've learned that today. That's a
Mm,
special take home for me. The fact that you have
mm.
a first scan and it's not revealing so much
Yes.
doesn't mean you should panic or just give up. You should still have some form of hope.
Yes.
There might just be a change after a few days
Yeah.
that you, as you're hoping, and sometimes it could be the other way around. But we hope somehow that whichever way works for you, that somehow you're able to achieve your fertility dreams not too long from now. So, Dr. Every, what would be your counsel to people as we wrap up this session
Yeah.
today?
So my counsel is be like this couple. Don't give up. Don't
Yeah.
give up. Be open, to seeking help. Sometimes you might need to seek help in a different place. Be open to coming to Alps. I have to speak
Yeah.
for Alps. Be open to coming to for Alps, and be open to the counsel that you're giving. And then, like I always say, as long as there's life, there's hope. So
Yeah.
never give up. That's just it. Don't give up on those your dream. Those dreams are very, viable. They can still come to life. Don't give up on your dreams of
Don't
having
give
your
up.
own children.
Mm.
Yeah.
Don't give up, no matter how hard it may be. Just
Mm.
hang in there. It's
Yeah.
going to happen soon. And while you're waiting, please keep trying. Don't just wait and wait in vain. While you're
Yeah.
waiting, keep
Yeah.
trying and make sure you're trying
The right
in the right
places.
place.
Yeah.
Yes, and your trying is validated, not anyhow wrong decision kind of trying. Let's it while you're trying in the right place. Take right counsel. Don't take wrong counsel and keep doing the same thing over and over again. It's been amazing having your idea of yours stay with us today. It's weekend, so I really do hope that you all have a very lovely weekend. And for you, dear viewers, keep dropping your questions, your thoughts, and whatever your concerns are, I will definitely attend to them. For someone hearing us for the first time, you want to book an online consultation, of course, you could do that. We're just a phone call away, a DM away. You could just send a message, book an online consultation with the number being displayed on the screen, and you'll definitely get attention as soon as possible. Thank you so much, Dr. Deborah, for having this good time
Thank
with
you,
us
Ruth.
today. And
Always.
thank you, dear viewers. Thank you so much for staying tuned. Until we come your next way next time, have a lovely evening. Bye.